Today, I like to talk about diphtheria. Diphtheria is a very important disease of public health importance. And in 1994, Russia had an outbreak which claimed over 1,500 lives. In fact, over 50,000 cases was recorded in Russia in 1994. And in some countries where immunization program is very poor, compliance is very poor, like in some parts of Africa, like Nigeria, for instance, we have a lot of outbreaks of this diphtheria in some years. In 2024 alone, this year alone, over 7,000 cases of diphtheria have been reported. And between 2022 and 2024, over 27,000 cases of diphtheria were reported. So this shows that diphtheria is a very important disease condition in this part of the world. So we're talking about diphtheria. I'm talking about diphtheria today. And then I would like you to follow me to join wherever you are connecting from. Diphtheria is caused by Corynebacteria diphtheriae. It's it's actually a gram-positive bacteria, non-filamentous bacilli, and it causes certain pathogens. The infection is affected or affects different parts of the body. One is that it affects the throat, the mouth, the pharynx, it affects the larynx, it affects the genitalia, it affects the skin, it can affect the kidney and the heart as well. So this condition is very, very fatal in some cases. So it's important to know a little bit about diphtheria, and that's why I'm coming up with a topic like this. So as I said earlier, it's usually common in areas where immunization is very, very poor. It affects different parts of the body, which I listed earlier. And what it does its effect, or it carries out its pathogenic activity in two different ways. One, it may be as a result of the direct effect of the bacteria itself. The bacteria itself can cause sore throat, can cause low-grade fever, and also in this process, it may also cause individual pain in different parts. If it's in the larynx, it can affect the voice, causing hoarseness. It may cause stridulous respiration or respiratory difficulty. It may cause coughing, whooping cough, which is a paroxysmal and often very, very distressing to the individual. If it's on the genitalia, it may cause rash. Importantly, there's a pseudomembranous plaque that is formed by the Corynebacteria diphtheriae. And wherever it affects, once this plaque is there, either on the tonsils, on the other parts of the oropharynx, the base of tongue, the larynx, the brachybronchial tree, it may cause this pseudomembrane to form patch on this mucosal surface. And an attempt to scrape off this pseudomembrane may lead to bleeding, which is pathognomonic of diphtheria. Once you try to scrape the pseudomembrane off the surface, it causes bleeding. And this is one way you recognize that, yes, you may be dealing with diphtheria in this case. There are actually three strains of this diphtheria. There is the gravis, there's the intermedius, and the mitis. The gravis is actually the most common in causing diphtheria epidemics, while that of the intermedius and mites are rare. So the early presentation is usually that of either the pharyngeal and then later that of the laryngeal. By pharyngeal, I mean affecting the throat, affecting the area of the nasopharynx, the oropharynx, the hypopharynx, either the tonsil, the posterior wall of the pharynx, the base of tongue, or it goes down to affect the larynx, the area of the voice box. And when this happens, if the area of the voice box or the larynx is affected, an individual would have stridulous respiration, difficulty with breathing, then also hoarseness. And this may further progress. This action or the effect of this diphtheria may be due to either the effect of the organism itself or effect of the exotoxins, because diphtheria actually secretes or releases exotoxins. Once the exotoxins are released, it can affect these different areas also: the pharynx, the larynx, the skin, and the other parts of the body. The sore throat and the low-grade fever usually precedes the appearance of the pseudomembrane. So by the time the pseudomembrane also exudates or pseudomembranous plaque is already forming, the sore throat may have subsided, the fever may have also reduced significantly. So by the time you attempt to remove the pseudomembrane, you just discover that there's bleeding from the underlying tissues. The effect of the exotoxins are those effects on the heart: myocarditis, effects on the kidney, renal tubular, acute tubular necrosis, and also effects on the palate where there's a peripheral neuronitis. So this causes palatal paralysis. This usually occurs between the 3rd to 7th week of the infection. There are different other conditions that may mimic diphtheria. One is the membranous tonsils, whereby there's exudates over the tonsils. It may actually mimic diphtheria, but in the case of the diphtheria, once you try to remove or scrape off the pseudomembrane, there's bleeding. This does not occur in the case of membranous tonsil. Also, because of the laryngeal effects causing bleeding, causing difficulty with breathing, causing respiratory embarrassment, one may also think that is this acute epiglottitis, which is also a close differential, but it's different from acute epiglottitis. The presentation, look at other history that the patient presents with. This diphtheria is quite different. It doesn't cause that tripod nature or patient having to extend the neck, drool in certain way, and also when you do your x-ray, that's thumb sign of the epiglottitis on lateral x-ray. You do not see that in diphtheria infection. So basically, also a patient may have a bull neck. Patient may present with bull neck. This may be due to, or this is usually due to the infiltration by the cellulitis within the neck. So formation of cellulitis produces the bull neck, and at this point you know that there's infiltration of the neck. The lymphadenopathy may also cause that bull neck or cellulitis. So those are the two things that makes that patient with diphtheria come down with what looks like a bull neck. You know, the neck is thick, the neck is huge, it appears bigger, and then very tense. So you suspect diphtheria if you find a patient in any setting presenting with bull neck. So the first thing you think of is possibility of this being diphtheria. So how do you investigate it? Yes, full blood counts but the diagnostic, what we call the major index for diagnosis